My name is Dr. Bill Bixler. I am a clinical psychologist. Let's distinguish between substance addictions and process addictions. Substance addictions are things ingested into the body. Process addictions are the behavioral addictions, such as gambling. People can have shopping addictions. There are three basic criteria for an addiction. The first is preoccupation, thinking about, planning for, spending a lot of time with one's life revolving around the addiction. The second is called loss of control. An individual making vows to him or herself to stop. They decide, I don't want to do this anymore. I'm done. And they fail. Time and time again. So there's a loss of control. The third one is continuation despite consequences. So the alcoholic may have already gotten a diagnosis from his physician that your liver's starting to show some real problems, and the person keeps doing it. 20 million Americans suffer from a substance abuse disorder. That doesn't count the process addictions. Who can become an addict? I think anybody can. Not everybody does. There is some evidence that there may be some genetic predispositions to some addictions. There's lots of studies that talk about the reward systems in the brain and how addictions hijack the brain, both in terms of creating that craving, and then there's parts of the brain that remember pleasure, and those get activated. So it's not an excuse, but it is a fact that there are brain changes with addiction that I don't think are there with other kinds of sinful behavior. Describing is not excusing. To describe is to understand is try to help, and God has put us in the helping business, and of course, as Christians, we are called to help, to assist each other, to be there for each other. Addictions are about dealing with pain. And that's something people do not understand. The addict is trying to deal with pain, hurt, wounds, damage, self-esteem issues, abuse in their history. The addiction, that behavior of doing that, is a form of self-medication. They're trying for a very brief time to feel just a little bit better. First thing a church can do is open their doors to 12-step groups for space. There are a number of AA groups and other kind of groups that primarily meet in churches, which is a wonderful thing. Being able to come alongside people that you find out are struggling with this, if it's made known, to show love and compassion, to not stigmatize them. We who are made in the image of God need connection, both with our Creator and with other people. And addicts need connection. Addicts are cut off. And so when they're cut off, they feel bad, they feel terrible. What do they do to feel better? So establishing connection are things that churches can do to show grace to these people.